Hello, and welcome to all of you joining us here at the Happiness Festival, hosted by the Happiness Institute at Oxford in association with Going Life and the Oxford University Psychology Society. My name is Raymond Ho. This is Lauren Charters, and we'll be your host for this session. Our guest today is Professor Sarah Lipson. She's an assistant professor in the Department of Health Law Policy and Management at the Boston University School of Public Health. She is the co-principal investigator of the Healthy Mind Study and associate director of the Healthy Mind Network. Dr. Lipson's research focuses on understanding and addressing the mental health inequalities in adolescent and young adult populations, especially in college students. She's going to talk to us today about mental health among transgender and gender non-conforming college students, drawing from nearly 10 years of national data from the Healthy Mind Study to understand mental health outcomes among gender minority college students. This topic has never been more pressing, especially when the health of gender minorities are being politicized. So how apt it is that we are discussing this topic during Pride Month. So welcome, Sarah. It's an absolute pleasure to be hosting you at the Happiness Festival.
Thanks so much for having me. I'm thrilled to have an opportunity to talk about this and to share a little bit of my research today. So yeah, just a quick overview. I'm going to talk for about 15 or 20 minutes. And then we'll have time for some questions at the end. So yeah, I'm going to be talking about mental health in college and university populations. And I'm talking about undergraduate and graduate students. The main outcomes that we're going to be thinking about today are symptoms, so prevalence within the population, and then help-seeking behavior. So who's actually accessing treatment, what are the barriers and facilitators to that? And specifically, we're going to be thinking about understanding and addressing mental health inequalities that are experienced by transgender and gender non-conforming college students, and the key risk and protective factors for mental health in that population. I'm going to go over some recommendations for campuses and then talk a little bit about the need for research to advance equity. And that's really the motivation for my work. I identify as a cisgender woman. I'll talk a little bit at the end about how important it is to have the work informed by individuals with lived experiences. And I have a student advisory board that is helping with all this work and without whom this work would not be possible. And just really, emphasizing that work to advance equity in mental health can't just fall to, traditionally marginalized populations. So as a cisgender woman, I come to this with the goal of trying to help advance mental health equity for trans populations and in particular college students. So with that intro, let's just get a couple kind of terminologies understood. So I'm going to use the term transgender and gender non-conforming. I'll use the acronym TGNC. And you can see here, this is an image of the genderbread person, which is often used to kind of really show the many dimensions of gender identity and gender expression and attraction. The way that I'm going to be defining trans and gender nonconforming students are students who, based on two questions, the first question in the survey asks about assigned sex at birth, and the second question asks about gender identity. So trans and gender nonconforming students are any student for whom their sex assigned at birth and their current gender identity do not align, as well as all students who indicate that their current gender identity is trans or gender nonconforming or genderqueer or of a self-identified gender. And we really need more surveys that measure both sex assigned at birth as well as gender identity. So mental health on college campuses really is a public health priority. So why should we care about this? What data exists on this overall population? So the traditional college years, around age 18 to 25, those years directly coincide with the age of onset for lifetime mental illnesses. So I became interested in this work through experiences that I had working in residential life at a university and living with first-year undergraduate students, many of whom were experiencing their first signs and symptoms of mental health problems during that time. So this time really is an epidemiologically vulnerable time, and therefore an opportunity for intervention and early intervention in particular, as well as prevention. Mental health is very different from physical health in a lot of ways, but one really key way is the treatment delay. So for physical health problems, we break a leg, we're, experiencing some type of physical pain, we tend to seek care. There certainly are issues related to access to healthcare. But with mental health care, the median delay from first symptom onset to first treatment contact is a decade. And many people never seek care, and there's enormous negative consequences and costs associated with that. So the fact that many students are experiencing mental health problems for the first time, or they're intensifying during college, which is also this really key time from a developmental perspective, newfound autonomy, it's also a really key time for gender identity and development. There's also in the US more than 22 million students who are enrolled in post-secondary education. So that's access to about half of all adolescents and young adults in the United States. And then mental health during that time, during ages 18 to 25, and certainly earlier adolescence and youth mental health as well, is enormously predictive of lifelong trajectories in terms of economic outcomes, social outcomes, educational outcomes. So for these reasons and more, focusing on mental health and investing in mental health during college and in college student populations is a really important investment and something we should care a lot about. So I'm going to be using some data from the Healthy Mind Study, which I lead with my colleague Daniel Eisenberg and our incredible team of researchers and study coordinators who are listed here on the slide. And we have conducted this study now at over 350 college and university campuses, the vast majority being in the US. We have some campuses across the world, but the vast majority are in the US. And we have over 300,000 students who've responded to the survey. It's conducted with random samples of students, and it's conducted annually. So we're going to be using data from about the past 10 years. It's an online survey, and we use validated screening tools for mental health. So, rather than asking, do you feel depressed? For example, we're using an instrument called the Patient Health Questionnaire 9, which is a 9-item instrument used to measure the 9 core symptoms of a major depressive episode. It's actually the same instrument that many people would be administered if you went in to seek clinical care. And in this case, we're administering it in a survey. So that's a real strength of these data. Like I said, so we use these validated screening tools, depression, the PHQ-9, a score of greater than or equal to 10 on that scale is considered a positive screen for major depression. And the other two outcomes that I'm going to show in terms of symptom prevalence here are anxiety, which is measured by the Generalized Anxiety Disorder 7 scale, and experiences of suicidal ideation in the past year. And the Healthy Mind Study is one of the only population-level surveys that includes measures of gender identity alongside validated measures of mental health and well-being. And so it's really this unique opportunity to be able to talk about a population, trans and gender non-conforming adolescents and young adults, that are often omitted from research due to small sample sizes, or they're combined with a broader category of LGBTQ individuals. And our data really allow us to look at this unique population and understand their needs. I'll mention this again at the end, but I just want to emphasize here for anyone listening, anyone who's interested in doing this work, we make all of our Healthy Minds data publicly available for researchers, including students and trainees who are interested in this line of work. So if anything that I talk about today kind of sparks another research question for you, it's one of the greatest joys of leading this work, is knowing that the data can be used by others to advance mental health equity. So trans and gender non-conforming students experience a disproportionate burden of mental health problems. I'm going to show the magnitude of these disparities, and then really try to hone in on some of the factors that might explain this. It is widely understood that these disparities are not attributable to some, biological or, individual level reason. These disparities are really born out of societal and social factors and the lived experiences that these students are facing. So again, I said we're going to go through these three different outcomes here: depression, anxiety, and suicidal ideation. And you can see here, I'll just kind of pause on this slide because I look at these numbers all the time and they always kind of make me step back and take pause, just the magnitude of disparities that you can see here. So again, clinical symptoms of depression, 60% of trans and gender non-conforming students are screening positive for depression relative to 25% of cisgender students. There has been a lot of attention on what many people call a campus mental health crisis. So I by no means want to say, 25% of students screening positive for depression is not a problem. That in and of itself is a problem. But there's, this enormous disparity that exists here. Similarly, for anxiety, 21% of cisgender students are screening positive for clinical symptoms of anxiety relative to 44% of trans and gender nonconforming students. 1 in 10 cisgender students reporting suicidal ideation, thoughts of suicide in the past year relative to over a third of trans and gender nonconforming students. So I'm going to go through 2/3 really key risk factors, things that we know are negatively impacting mental health. And I chose these not only because, we have limited time here today, and I want to highlight not only the factors that are most predictive of mental health, but also the factors that are most changeable. We can be reducing the discrimination that students are experiencing on college campuses. Campuses tend to be these really, in some ways, for better or for worse, kind of isolated environments, and there's opportunities for intervention and education and training and ways to reduce discrimination, at least within sort of a college bubble. And there's a lot of work left to do there. So here I'm just showing the fact that we know that discrimination is really, really predictive of mental health. So among students who've experienced discrimination, these are all students overall, 35% of them are screening positive for depression, relative to 23% of students who did not experience discrimination. And you can see really similar patterns here, where students who've experienced discrimination are at higher risk for mental health problems. Many trans and gender nonconforming students, especially those who were out in high school, begin college with a history of victimization, and that's something that campuses really need to be more aware of. You can see here the prevalence of experiences of past year discrimination among cisgender students versus trans and gender nonconforming students. 65%, so nearly 2/3 of trans and gender nonconforming students report that they've experienced discrimination in the past year. And I won't read this entire quote. It's from the UCLA Williams Institute report entitled Transgender Students in Higher Education, which is one of the best, quick resources that's really highlighted the work that needs to be done. But the very beginning of this quote just says, college has the capacity to reinforce the gendered and transphobic treatment that many students have already experienced in school and in society. Or alternatively, college can play an important role in facilitating gender identity exploration, providing students with supports and resources needed to allow students to navigate this process while staying in college. So campus environments really can be highly protective, and some are. I'm going to talk a little bit later about the ways that we're kind of tracking and reporting on system level protections for trans students on campus. The second, so discrimination is the first risk factor I wanted to highlight, and the second here is sense of belonging. And this graph is just showing among students who say that they feel they're a part of the campus community, 27% of them have a positive screen for depression, anxiety, or suicidality, one or more of those, 27%. For students who say they don't feel like they're a part of the campus community, over half of them are screening positive for one or more of those conditions. Comparing cisgender and trans students on a couple different measures of sense of belonging. So I don't see myself as a part of the campus community. About half of trans students are saying that. About 20% are saying that people at their school do not accept them for who they are. And 40% are saying that they feel isolated from campus life. The second outcome that I want to talk about, and I'm going to try to bring it all back in the end, and hopefully also our conversation will at the end, we'll talk about this as well, but I want to move from talking about symptoms to now talking about treatment and access to gender inclusive care. So the good news in some ways is that when in need, trans students are reporting higher rates of mental health treatment utilization even than their cisgender peers. So past year therapy or psychotropic medication among students with a positive screen for one or more of those three conditions we talked about, depression, anxiety, or suicidal ideation. 68% of trans and gender nonconforming students have received some form of mental health treatment in the past year, relative to 48% of cisgender students. But trans and gender nonconforming students are vulnerable to insensitive, incompetent, and even destructive treatment by mental health providers. There's higher rates of treatment dropout. So the measures I showed on the last slide are just, walking in the door, getting any form of treatment. Trans students, there's higher rates of treatment dropout, and that's attributed in many ways to the experience that they're having once they're in the door and with a mental health provider. Some of the common concerns that trans students report, and I'm really looking forward to some of my upcoming research, which is going to dive more into this, are, spending time, trans students report spending a lot of time kind of educating their mental health providers about the trans experience. They also report an invalidation of their gender identity, denying the trans experience, especially non-binary identities. Students also say that sometimes their therapists have overemphasized their gender identity and centering it as the root cause of all of their mental health issues. Students have also encountered avoidance of their trans identities, wherein therapists seem unwilling or uninterested in addressing their gender. And some say that their therapists may not have been explicitly transphobic, but that they lacked competence in trans issues and were generally unhelpful and sometimes expected clients to educate them, like I said. 1/3 of transgender college students report being misgendered often or sometimes by campus health services. So this means that students are going to a space that is, ideally going to be one of the safest spaces for any student on campus. You're going to seek help and support and to experience that, to be misgendered, to be referred to by the wrong pronoun, or to have what's called, your dead name, your former name being used. That's just a traumatic way to try to enter treatment, and 1/3 of students are reporting that experience. Also, interestingly, and I was just diving into the data yesterday and last week as I was preparing for this talk, as much as we know that trans students are seeking help at higher rates, there's also higher rates of what we think about as self-stigma, so kind of judging oneself. So over 50% of trans students say they feel ashamed of having a mental illness, or that they keep their mental illness a secret. And a higher proportion of trans students say that they wish they could disclose their mental illness to others. So now turning to what should campuses do to support trans and gender nonconforming student well-being. And this is really where I'm trying to use research to try to answer this question and to disseminate research to campuses. A lot of this is going to come from a report that was put out by the Williams Institute, which is out of the University of California, Los Angeles School of Law. And they have a number of recommendations. So policies and protections, so non-discrimination policies that are inclusive of gender identity and gender expression, that codify protections and prohibit transphobic acts. And these need to be widely disseminated, discussed, and enforced. Curriculum in college should address gender identity and specifically trans identities and experiences. Trans and inclusive content is beneficial both to trans and to cisgender students. It should be incorporated across disciplines and in some depth. I certainly wish that I had had more of that in my own undergraduate and graduate training, and encouraging faculty to develop trans inclusive content and really incentivizing that. Trainings and educations aimed at students around trans identities and how to be an ally. And this education can begin in new student orientation when students arrive on campus, as well as training student leaders like resident advisors and residence halls is particularly important. Trainings and educations aimed at faculty and staff. And the many, there's just so many ways that students interface with aspects of the campus environment. And of course, this is different now in a COVID world, but it's still really important to think about, campus security, dining services, financial aid, residential life. All of these units that interface with students should be exposed to mandatory training, which include trans terminology, pronouns, tools to interrupt this gender binary, and how to act as an ally. And counseling and health services staff, I just presented some really quick data there to show there's a lot of room for improvement for the experience that trans students have when they seek mental health treatment, and a lot of work that can be done to train counseling center staff. One of the things that we know is most important for trans mental health and well-being is, being referred to by your chosen name and using the pronouns that you go by. That's such a validation, and the opposite of that is really traumatic, which I can only imagine. And there's so much bureaucracy as I've looked more and more into this and tried to advocate for this on my own campus. It's really, there's a lot of barriers that could be used as an excuse to this, but really just can't be anymore. We need to make the system easier for trans students to change their name in all campus records, so that every time they go into a classroom, they're not having to tell someone, this is the name I go by actually, and these are my pronouns. There should be an easier way to do that at a campus level, so that students are not, continuously misgendered in every interaction that they have on campus. And that there are alternatives to male, female pronouns given. That documents, forms, and records reflect this as well. So, like, for example, basic things like language in admissions information or information sent to parents, it often says like, your son or daughter is going to be, joining the class of, 2025. And instead, what a simple change to say your child. That's, so much more inclusive. And then consistency across offices. So admissions, the registrar, all of this really requires campus collaborations. I just wanted to highlight this one, really powerful empirical study, which found that chosen name was linked to reduced depressive symptoms, suicidal ideation, and suicidal behavior among transgender youth. Which I think, if we think about it logically, that is not surprising, but we really need more and more evidence to be able to show this and to advocate for why this is so important. And then the last few policies I'll just go over quickly. Gender inclusive restrooms on campuses, gender inclusive housing on campuses is extremely important. I kind of touched on this already, but trans inclusive and sensitive counseling and healthcare, and then trans specific spaces. So oftentimes there's, LGBTQ resources on campus and university sanctioned LGBTQ student groups. Something that's really important to keep in mind is that these are often primarily white spaces, which trans people of color, trans students of color are a population that has been even more ignored than the overall trans and gender non-conforming student population. And we need to really be thinking about how we create safe spaces for those students. In my upcoming research over the next 5 years, I'm leading a major study that's in collaboration with Campus Pride, which is the leading national organization in the US that's been compiling and tracking campus policies and showcasing, champion schools that have really inclusive policies. They have non-discrimination policies that protect against discrimination around gender identity and expression, that allow students to change their names, that have gender inclusive restrooms and housing, that do mandatory trainings, all the things that I just talked about. And they're tracking that for hundreds and hundreds of campuses across the country. And they're also highlighting the campuses that really, have a lot of work to do and have not yet created spaces that are safe enough for students to be at. And this is a resource that is helpful for prospective students who are looking at, which college or university to go to. And I think it's also a really, really helpful resource for people who want to be allies of this work. Any college student could look up their university here in the US at least and say, oh my gosh, I did not know that my college or university did not cover hormone replacement therapy for students who are seeking that form of care. And that's not fair. And I want to do something about that. And I'm going to advocate for that. So I think it's also a really helpful tool for allyship. So the last thing I just want to touch on is how research can advance mental health equity for trans and gender nonconforming students. So this is a population that is oftentimes not even measured to begin with. Surveys just will ask, binary sex, or sometimes they'll refer to that as gender, and there will only be two options. So there's actually no way to even identify individuals who are trans or gender nonconforming. There's oftentimes really small sample sizes, which means that trans populations are combined with sexual minority populations. And that's, that there has been a lot of important research in that area, but it's in some ways a disservice. We don't understand the unique needs of trans students. And in some ways we may be advocating for policies and programs that are important for sexual minority students and that aren't, as important for trans students. And ignoring some opportunities for advancing equity for trans populations. The Healthy Mind study, the data that I shared, the survey data from colleges, like I said, that's a publicly available data source that contains measures of gender identity. We are able to identify, I'll show just my second to last slide, I believe, is one of the papers that we put out where we used Healthy Minds data, and we had a sample of over 1,200 trans and gender nonconforming college students. That's a massive sample size for this population. We were actually even able to look at variations within that population across race, ethnicity, across sex assigned at birth. And so for anyone who's interested in doing this work, we make these data publicly available. Research is really needed to advance equity for mental health and well-being. Evidence is a really powerful tool for advocacy. And I'm, like I said, starting this new national research over the next 5 years, looking at the effects of campus policies on trans and gender nonconforming student mental health outcomes, and putting together a student advisory board of students with lived experiences who are informing this work in collaboration with Campus Pride. And also looking at the intersectionality of gender identity and race and ethnicity. I think this year with Pride, we're actually seeing a lot more around, a movement to talk about Black trans lives and the importance of that population. And it's a population that's, really not been looked at a lot in data, and I'm hoping to provide, some new evidence there. So just wrapping up, this is one of our most recent papers. It came out in 2019 in collaboration with many of my colleagues. It's in the American Journal of Preventive Medicine. It's really a descriptive paper reporting some of these statistics from the Healthy Mind study and kind of laying out a research agenda in this area. I really want to thank my Healthy Minds team, all of the student participants who've contributed to this research. We have many collaborators and partners who I've mentioned here, and then incredible organizations that have chosen to fund this innovative research. And with that, I will stop sharing my screen so then we can see each other in a little bit bigger picture, and we can have a dialogue about this. All right.
Fantastic. Thank you so much, Sarah, for your talk and for your insights into the Healthy Mind study, and particularly what campuses can do to help as well. So now Raymond and I will be asking some questions so we can have a discussion on the topic. Yeah. So for our first question, on the topic of what campuses can do, what, in your opinion, is the most important thing that schools, colleges, and universities can help support the mental health of their transgender and gender non-conforming students?
Yeah, I think it's system level changes. It's kind of doing an audit of the environment with student input and saying, where are the ways in which you are experiencing discrimination. We often talk about that as being structural stigma or structural discrimination. And campuses can be doing things at an individual level, of course, but I really think the broadest changes come from policies. So, allowing students to change their name in a campus record and making sure that is implemented across every unit that a student will interact with, housing, every faculty member that they see. When they seek campus health services and they're waiting in a waiting room and their name is called, it's the name that they identify with and those pronouns are used. And that a non-discrimination policy includes protections against gender identity and expression, and then that's really enforced across all campus units. So I think that structural change is what's most important. In terms of which of those policies might be most important, there's evidence that name change policies are really, really important for mental health. As well as facilities on campus. So having, single stall bathrooms or gender inclusive restrooms, as well as housing options for students. The lived environment is just so important for well-being overall. And that's, really important for trans students.
Yeah, it sounds like validating a student's identity is the most important thing that we could do to help support students. Mm-hmm. We've talked about what campuses can do, but what can fellow students do to help support their transgender and gender non-conforming peers?
Yeah, I think, so we know that about 3 to 4% of students identify as trans or gender non-conforming. And so if we were to say, all advocacy and all change falls to, those 3 to 4% of students on campus, to create all that change, that's a huge burden for those students to hold, in addition to the trauma that they've experienced. And so I think there's a really big opportunity for cisgender students to serve as allies. And like I said, you can look up your campus and say, like, what's my campus doing well? What's my campus not doing well? And try to advocate for that change on your campus, and look for those collaborations with, LGBTQ centers on campus. Look for faculty and staff who can be allies in that. And then there's, opportunities for, educating yourself, trying to understand the trans experience, trying to understand intersectionality around that. I mean, if we're making progress in racial equity, we need to also at the same time, right now, the door is open for a lot of conversations around equity. And so I hope that many college students are going to, kind of feel this fire and intensity and are not going to back down.
That's a really powerful message. I think particularly in terms of Pride Month, it's a really good opportunity for people to take action as well as building their own awareness of these things.
Yeah, and I think college students, I've always loved the college environment. Like I said, I worked in residential life. Now I'm faculty and I'm really involved in student life at my university. And when people ask me, why do you love the college environment? It's just, there's so much energy. There's so much passion, young people who are oftentimes, for the first time, really finding their voice, finding peers who share similar viewpoints and becoming advocates, growing into being advocates. That oftentimes is happening in college. And so I think that students, really have an opportunity to create change on their campus. And it's not just, what can I do as a student? For example, I'm at Boston University. What can I do as a student at BU and seeing the change that you can make there? But how can I think about the other institutions that are within my city? Or how can I, advocate for the change that happened here, happening at other schools? And there's just kind of a national opportunity as well, and international as well.
Yeah. Well, so yeah, in terms of the wider healthcare system, how would you say that the current healthcare system is impacting the mental health of transgender and gender non-conforming students and young people at the moment?
Yeah. So a lot of the issues that I raised in terms of having trans-inclusive mental health care on college campuses extends to the healthcare system overall. And in the U.S., the past nearly 4 years have been very tumultuous for trans protections in healthcare, and providers being able to, turn away patients, not provide care if they, have a moral objection to an aspect of a patient's identity. And that is horrific. I mean, and to think that that's the country that I live in, that's possible, is just, that those policies are being advocated for and pushed for is just horrific. So beyond, the basic protection of being able to access healthcare, there needs to be a legitimization of youth in particular. So youth who are experiencing gender dysphoria, who are, thinking about their gender identity, and having providers who can help them, think that through in a compassionate and understanding way, and with a strengths-based. I mean, you would probably know even more about this as folks who are training in psychology, but coming at it from a strengths-based perspective as opposed to a deficit. Saying, you have so much to contribute to this world, and understanding just the many enormous strengths that trans youth bring.
And what would you say that healthcare systems can do to help better support their gender minority students, and how is that different from cisgender individuals?
So covering hormone replacement therapy, there's an enormous amount of variation in whether or not student health insurance in the U.S. Covers that. And I think that's something that campuses need to prioritize is covering hormone replacement therapy for students. Having providers, like I said, who are trained in providing trans-inclusive care, understanding, particularly for campuses that are in cities or in urban areas where there are, mental health providers in the community, to know which of those providers are, expert in thinking about the issues that trans adolescents and young adults experience. Is I think a responsibility of a campus counseling center to understand who else in the community might I be able to refer this student to. Trainings for oftentimes this misgendering that students experience comes from, an administrator who's at the front desk in a counseling center. The forms that students have to fill out when they arrive in a counseling center oftentimes will just have, 2 boxes to check, male or female. That's such a easy change to make. I mean, that's opening up a Microsoft Word document, and the thought of doing that and reprinting those forms that could be really impactful for a student who's seeking care is so important. Of course, having mental health providers who identify as trans is an enormous benefit. That there aren't enough trans mental health providers. That's sort of a barrier that is a little bit hard to overcome for many campuses. But also creating an environment within a counseling center where if the opportunity presented itself to hire a trans or gender nonconforming provider, that provider would be entering into a space that is safe, where they're not having to educate all of their colleagues about the trans experience. I think about that even as a faculty member, like, would a trans faculty member feel like they were coming into my department and having to educate everybody about what their experiences are, and, suddenly, having to take on that burden, or do we already have an environment in which someone could walk in and feel safe?
Yeah, absolutely. So we've talked a lot about healthcare and education and how we can support students in those regards and young people in those areas. So I'm going to hand over to Raymond now so we can talk about some wider societal issues.
Great.
Thanks, Lauren. So I wanted to start with a core question sort of relating to some of the views in our society. Choosing what sex or gender you want to be should be a fundamental human right. Why on earth are people so hostile towards gender minorities?
Yeah, that's such a good question. I mean, it's so, ingrained in society. It's fear-based. It's a lack of understanding. It's a lack of visibility. I think about, like gender reveal parties are such a horrible and silly thing. I mean, I hope there will be less of that, but I use that as an example because it really begins at that stage. We're assigning a gender identity to babies before they're born, and I guess I'll say I have a lot of hope in this regard. I see, I have a lot of friends who have young kids, and one of my friends' kids is in an elementary school, and the principal is transgender, and there was a lot of media attention around this, and there was, cameras and things outside of this elementary school, and my friend's daughter was like truly baffled by why this mattered at all, and that's really like uplifting to me. Like, she was unable to understand any explanation as to why this could be interesting. And so I do think that young people now are growing up in many parts of the US with less kind of rigid understandings of gender. So we are seeing shifts there, but it's fear, it's a lack of understanding, it's the religious, there's a lot of variation across the US in terms of where trans people are accepted and protected. And if you look in highly religious communities, that's tends to be where less acceptance is. Yeah.
So are you saying that sort of unless it's in sort of very religious community where they believe there only exists two genders, the issue is usually something that's relatively unconscious, and it's more due to a lack of exposure and a lack of understanding of trans individuals, instead of they are actively hostile against them?
Yeah, I think there's a continuum, right? And we're seeing this as well with, racial justice as well. Like, on one end is actively being anti-racist, actively taking steps to combat racism. And so there's also kind of like anti-transphobia, really saying, this is what I am doing as an individual. This is what I'm advocating for to advance equity for trans people, versus, on that continuum are also people who are just, you live your life, you do you. I'm kind of complacent around this. And then there's people on another end who are, really hateful and fearful. And we need to be, of course, moving more into the active anti-transphobic culture.
Absolutely. So I'm not sure whether this is related or whether there's a statistic on this, but is there a lack of training or research in transgender mental health, and why is that?
Yeah, there definitely is. Why is that? I mean, one first thought that comes, when we think about this, like kind of in academia, is that it's kind of inherently interdisciplinary. So does this fall in gender studies? Does this fall in public health? Does this fall to clinical psychology? And I think sometimes when a topic is inherently interdisciplinary, there may be courses and training that exist, but it really is not kind of embedded within the curriculum. It's sort of up to students who have an inherent interest in this to say, oh, I'm going to seek out that class about trans well-being and trans mental health. My limited experience in other disciplines where I've seen, social work, a lot of courses in social work are talking more and more about the trans experience and trans well-being in social work. A little bit more of that happening in public health. I happen to be in an institution that's very kind of advocacy oriented and very working to influence policy. So there's a lot of ongoing research at my institution around trans mental health and trans health overall. But we don't have courses on this, it's really like the student training isn't there. It's really the research that's happening. So, I think it really needs to be embedded within curriculums, and I think we can start that. I think about higher education, and of course this could be and should be starting in elementary school, but to have mandatory classes that students have to take in college beginning in their first year that focus on the trans experience.
So education is definitely something that we should do to help the public gain awareness.
Yeah. And your question is making me think a lot more about that. I've often thought about, trying to develop like a first year seminar. And I think a first year seminar on this topic could be really important.
A massive online learning course.
Yeah.
That would be very cool. Yeah,
absolutely.
So working in this field, what kind of intersectional challenges are there in the treatment of mental health and gender minority students? Maybe like in race or class?
Yeah. So I think the intersections that there's so many intersections to think about that are really important. Some are intersections of identity. So I think race and socioeconomic status being really important. There's also sort of intersections with mental health and other outcomes that like college persistence and retention. So the same students who are, experiencing a disproportionate burden of mental health problems on campus tend to be the same students who are least likely to graduate from college. And that's students of color, first generation students of low socioeconomic backgrounds. And so there's also an intersection to think about in terms of almost outcomes in a way. For trans students, I think, yes, intersections of race and class are probably the most important, or certainly the ones that have been thought about the most. I'll be really interested that the work that I'm starting involves large-scale survey research, but it also involves qualitative research, which will be some of my first experience really doing qualitative research. And I'll be interested in what other identities students emphasize as being most important to them. There's also sort of intersectionality within a trans identity. So what does it mean to be, a trans man? What does it mean to be non-binary or genderqueer? And the unique experiences for those students and the other identities that they hold.
Good luck with the coding. I can imagine that would be quite tedious.
Yeah. It'll be really exciting. It's actually in partnership with Campus Pride, that the organization that does all of the tracking of policies. They also run an annual summer leadership academy for LGBTQ students and and faculty and staff every summer in North Carolina, and they bring together, a national group of folks, and they're recently partnered with a group of historically Black colleges and universities, so that they're bringing LGBTQ students of color to this leadership academy. And I'll be attending that in next summer, hopefully in person, and the summer after that, and doing a large number of interviews there.
It's really cool to see all of them sort of unite together and form a connection.
Yeah, absolutely.
Speaking of connections, your president, President Trump, do you think, well, in America, but also globally, transgender mental health, or just transgender health in general, is being politicized? And is there anything that we can do to remedy any of the potential damages?
We need things to go our way in November. We need new people in office. We need to, I think, the recent Supreme Court decision protecting LGBTQ people from discrimination in employment. It's easy to know how important that is for LGBTQ people. I also would like to believe that there's some value in just how many allies are, just so overjoyed by this decision, and for the value that brings to our broader community, not just people who have a lived experience. So I think there's a lot of energy going into fall 2020. We need new people in office, and we need to continue to raise our voices. In terms of undoing the damage that has been done, there are so many things, but I'll come at it from a research perspective, which is that we know that history repeats itself. And so we need to have data to show the negative impact of these policies, and to show like this is actually what happens when we discriminate and marginalize people in terms of their mental health outcomes or their educational outcomes, or all of these outcomes that are actually, if I was trained by an economist, and think a lot about like, how can I translate this into the bottom line? So colleges and universities, for example, to come back to higher education as a setting, because that's what I'm most comfortable with, they care about their tuition. They care about student well-being. They care about all these other things, but really they can't run their institution unless they're getting, tuition dollars from students. And so if a student drops out because of mental health problems, or because they just don't feel safe on campus, or they die by suicide, that is a loss to the institution in terms of dollars. It's also a loss to society in terms of productivity. We know that, mental health problems are associated with a lack of, I hate to say it, I want to reframe it a little bit, but we know that mental health, is something that if we can treat it and support individuals' mental health, they are going to be more productive in the workplace. They're going to have, better relationships, less involvement with, social services. All of those things save and or generate money for society. And so we need evidence that actually shows that return on investment, the return on investment from mental health treatment and care, as well as the return on investment from protective policies. And so I think right now, research showing the negative impact of the Trump administration policies on outcomes that affect dollars is really important, and will be really important, the next times, or as there continues to be, anti-trans policies, to say, if you don't care about individual well-being, maybe you do care about, the excess spending that happens as a result of this.
So I wanted to move on to looking more at the future. Something that's more current and relevant to our lives is the recent pandemic. And I was wondering, what challenges would gender minority students face at the moment during the pandemic or the lockdown, and what can be done to help support them, particularly their mental health?
Yeah. That's a great question. So one first way of thinking about this is kind of what are the risk factors and environments that trans students come from in coming to college. So trans youth are more likely to experience homelessness. They're more likely to have experienced parental estrangement, to have been abandoned by their families. And so, arriving at college, the amount of resilience and just the ability to get to college if you've experienced that is phenomenal. So in some ways, campuses can be this really protective environment for someone who's not had a stable home even. And so with the pandemic and campus closures, I've been thinking a lot about, who's left on campus right now. Boston University, allowed students to stay on campus if they did not have a place to go. And I think there, are trans students across the country who have stayed on campus. And there's a very unique isolation that's associated with being on a campus that's otherwise relatively abandoned. So there's that. There's kind of homelessness and parental estrangement. There's also the fact that for many trans students, their campus community is where they have found some sense of belonging. Even there's a lot of room to improve there. To have suddenly lost, the peers who maybe are the first peers they've ever felt like understood them. That's a huge loss for a student. Access to care like hormone replacement therapy. There's so much evidence around increased discriminations when individuals are what's called like visibly trans. So when someone can tell, you're transgender, they're even more likely to experience discrimination. And so to not have access to hormone replacement therapy or other transition-related healthcare, that could in and of itself, of course, be really traumatizing and upsetting for someone's, gender identity and development, and then also potentially open them up to even more discrimination. Trans students of color, we need to be thinking about their well-being in enormous ways right now. Those are some of the things that I've been most thinking about. I'd be curious if you have any other thoughts that you were thinking of when you asked that question, because there are so many dimensions to thinking about how the pandemic is affecting young people.
Yeah, I agree. There's just too many things that we can do to help support them, and social support is definitely the most important thing that we can provide for them. And I was also wondering, because it's exactly because, as you said, that the campus has fostered a community and given them a sense of belonging. Losing that is going to be very detrimental to them. And when I asked this question, I was just more thinking, is there anything else that society can do to actually help them build resilience and to actually help them cope with mental illnesses?
Yeah. So I know I already talked about continuum, which is one of public health's favorite ways of conceptualizing something, but we can also think about mental health resources along a continuum. So over the past several weeks, the first trans crisis hotline was released in the US, which is an incredible resource. I would think of that, kind of on the continuum, that's, on the crisis end of the continuum. There's also, I think, more, preventative work that can be done and outreach that LGBTQ centers are doing on campus, or also that, I think that faculty right now have a really unique role as sort of, we think of, mental health gatekeepers is oftentimes the term that's used. So people who are in a position to recognize when someone's struggling. And when we went remote in the spring, my first class, this was sort of in my mind that I was one of the only people who were seeing my students actually. And then in the second week, it occurred to me, I don't know that anybody has seen my students other than me. I don't think they've seen, residential life staff or academic department administrators. All these people who normally would just lay eyes on students are no longer laying eyes on students, and faculty are one of the only folks on campus who are continuing to actually see students. And so a lot of the work that I've been thinking about this summer is the role that faculty can play. We're launching a survey this fall of faculty to understand how they're, supporting student mental health, what their knowledge and attitudes are, and their experiences. So I know, reaching out to trans students and just letting them know that you're thinking about them, and it goes for all students, but those kind of social supports from campus, I think, are important. And just allyship, it's not entirely up to, trans youth to be advancing their own mental health and well-being, or to be building up their resilience. It's up to society to be advocating for that, and to be imagining the challenges that are being faced and kind of proactively trying to combat that.
I've been reading around lately, and I think one of the studies mentioned that family support is probably one of the most important things to them. And in a sense, I'm not sure whether you would agree, but it's only if we build a society that's supportive enough of these trans individuals, that's the only way that we can help nudge most of the families and the entire society, like as a whole, to actually help support them and help them pull through in these difficult times.
Yeah. The family unit is so key in this, and I don't know the exact statistic, and the statistic I'm thinking about is certainly several years old, but a high proportion of trans youth who say that they're not accepted by their parents, and that's just such a traumatic thing to have to go through. And there's so many repercussions of that. And I think the real kind of societal change happens with parents of young kids now, advocating for their trans children and saying, this is my kid, and they're beautiful and they're incredible, and really accepting them and becoming advocates. And there are so many stories of parents who are like that, and resources, many resources that are developed for parents, specifically recognizing exactly what you said, just how important they are for young people's well-being.
So I was wondering if you would like to send a message here to all our audience who might be in the gender minorities, to support them and their mental health throughout these difficult times.
Yeah, thanks for that opportunity. I think the message that I'll take the opportunity you gave me, and I'll give you one better, which is to also have a message to cisgender people as well. So my message to trans and gender non-conforming people, and in particular, college students, is to just know how much they are valued, how much they contribute to our, campus communities. We would not be the same without them, and we need them and value them in our classrooms and in all aspects of campus life. And that goes for society as well. And then my message to cisgender students and cisgender faculty and staff on college campuses is really to open your eyes to what structures and policies exist on your campus, and to question those policies and understand that they are changeable. So much of how higher education has evolved over decades and decades has come through student advocacy, and students in partnership with faculty as well and staff really do have the power to say, this policy is not acceptable on my campus, and I think it's about half of campuses in the U.S. that do not have policies that allow students to change their name in campus records. What a just unacceptable reality that is. And so I want to encourage cisgender students and faculty and staff to look at that at your own institution, and to raise your voice and say that there needs to be change.
So much for that very powerful message. And just to wrap off, we have a standard question that we ask all our speakers, which is, what does happiness mean to you, and what should we do in order to live a good life?
For me, I would say happiness is having a sense of purpose. So having, something that you care about, that you wake up and feel like it's meaningful and it's worthwhile, whatever that is. And it took me a long time to figure out really what would bring me happiness. But I think, deep down, what does bring me happiness is feeling like I'm doing research that has the potential to make a small impact in the world, and that I get to work with wonderful people in doing that. So my day-to-day life in that regard brings me a lot of joy. What we should do to live a good life. Well, I think right now it's really hard. So I'll give, I guess, some like kind of practical as opposed to like philosophical things. We need to be sleeping, we need to be eating well, exercising is so important as much as we possibly can. And responsible news media consumption, I think right now is really important for living a good life, staying informed and understanding what's going on in the world, but not being all consumed by the news media. That has a really potentially really negative impact. And I'll also add one thing, again, I think very specific to the college student experience, but finding a good mentor is like one of the most predictive things for student satisfaction on college campuses. And it's not always the first person that you're assigned to becomes your mentor. I actually found my mentor, not until kind of the end of my first year of grad school. And that person became, the most important person to me in grad school and a lifelong collaborator. And so searching for that and seeking that out and approaching someone that you think is, a good person who can really support you, because those people do exist on campus. So I think mentorship is really important there.
That I definitely understand. I've just graduated and now I'm desperately in search for a good mentor.
Yes. Yeah. And wanting to pay that forward too. I mean, wanting to, if I had phenomenal mentorship, and I will spend my career trying to pay that forward to students. So yes,
so,
congratulations.
Thank you. And so on that note, thank you so much for a wonderful talk and discussion, Sarah. And additionally, thank you so much for all the work that you're doing for gender minorities. They're very lucky to have researchers like you that are supporting them and finding ways to help them. And on a side note, we would absolutely love it if you could bring Campus Pride to the UK. I think that would definitely help a lot of LGBTQ students in choosing which university would suit them best.
Yes, absolutely. And thank you both so much for organizing this and for the conversation today.
Again, thank you so much, Sarah, for taking the time to speak to us today, and we wish you the best of luck in your future work.
Thank you so much.